Going from not being able to walk to meniscus growth, it's changed my life.
For me, it was immediate relief.
I was pain-free. I mean, I had no pain.
I think it took like 10 minutes, and I was better. I was walking better.
Everything is healing. It's healing your body.
If you can change the way you walk and the way your knees feel, why not try it?
This is the real deal.
Now this is where the problem arises, here.
Okay. Okay, and what kind of problem is that?
There's no strength there to carry the other foot down.
All right, Al, let's see what you got.
Much better.
Much better? And try to go up without a running start.
Al, I want to thank you for coming in this morning. I really appreciate you taking the time out to come on the program. And what I'd like you to do is just explain the problems you were having before you came into the office, the experience in the office, and then maybe go over the results that you noticed after the procedure was done.
Back in July of this year, I wasn't able to walk. My wife was gone. I got out of bed one morning and fell down. And about 2 days later, I found a cane, so I started hobbling around the house. Finally, the wife returned, and I went to a specialist in Naples, and they told me I needed a full knee replacement. At that point, it was out 6 to 8 months, thank God, and I went home and researched alternatives to full knee replacements, and that's how I found Dr. Davis. I was very skeptical because it's not mainstream. We took x-rays, and Dr. Davis decided that he could help me. After the first treatment, I was able to walk out the door without a cane or pain, and after the second treatment, I was able to walk downstairs. I've been at it now. I've been treating for just over 7 months, and my meniscus has started to regenerate in my knee. It's changed my life. Going from not being able to walk to meniscus growth, it's nothing short of spectacular. So thank you.
You're very welcome. And I mean, you basically said it all. I really don't have any more questions for you. All I would ask you to do, Al, is just if people are in a similar situation, they're facing a knee replacement surgery and it feels kind of hopeless, but maybe inside they're thinking, you know what, there's got to be another option. What would you say to those people?
I would ask them to don't hesitate. Come and see Dr. Davis. You'll find the staff here very friendly, and you'll walk out on your own power without pain. That's my recommendation.
Thank you very much,
Okay.
Al.
Thank you.
If you're suffering with chronic degenerative knee pain, you've tried the injections, you've taken the drugs, you've had the different therapies, and you still have little to no improvement, I encourage you to take down our phone number. For only $60, we will do a complete neurological examination, and we will determine whether you are a good candidate for the non-surgical operation that we perform in our office. God bless you. I look forward to meeting you soon and helping you.
Ollie's finished her first treatment with Dr. Davis. So, Ollie, let's see what you can do. Can you stand up for me? Well, that's fast. All right, let's try that squat again. Arms right out in front of you. How low can you go? Whoa! Wow, look at that! Slowly come back up. Wow.
Ollie, I want to thank you for coming out to the program today. I really appreciate you spending the time with us this morning. And what I'd like you to do is tell us a little bit about what brought you into my office, the knee problems that you were experiencing, how is it affecting you at work, and then the experience that you had in our office.
Well, what brought me in was my pain was like a 9, and that's almost to cry. So I was up early one morning, I seen the commercial. I said, now that's me. I said, I need to go and see this doctor. So I did, and when I came in, the staff was so helpful. They made me feel like they already knew me. So I came on in, and y'all worked on me.
Thank you. We have a great staff. We have Becky and Jean are fantastic. We kind of have a family here. You know, you're here for a short period of time, but we really do enjoy our patients.
Yes.
Can you give me or tell the audience a little bit about your experience when you were in the office, the procedure, how long it took the first time, and then afterwards, what improvement you noticed?
We talked, and you worked on me, and then I think it took like 10 minutes. And I was better. I was walking better. And then after the procedure, I went back to work, and I noticed I wasn't rickety. I could get up out the chair and keep moving. Before I had to get up and stand there before I move. But it's better now. I'm just so happy.
Well, thank you very much. And if there's anything else you'd like to say to people that might be suffering with chronic degenerative knee pain, they may be faced with injections, even surgery, is there anything you would tell them?
Yes. When you get here, you'll feel the love in this office, and that's a good thing.
Thank you, Ollie. So if you or a loved one are suffering with chronic degenerative knee pain, you've been to different doctors, you've had injections, you are facing surgery, maybe you've taken a round of medication or had therapy, give our office a call. We do a non-surgical operation in the office, and you will have 2 visits in our office so that we can determine whether you're a good candidate for the procedure. So for only $60, you can come into our office, have a complete neural evaluation, and we will let you know whether or not you're a good candidate for our procedure.
Oh yeah, that one feels better. I think it does.
So what have you noticed there, Susan?
No, that felt better. That seemed faster.
You're going at a faster pace?
Susan, thank you so much for coming out this morning. I really appreciate you coming on the program. What I'd like you to do is just tell me a little bit about the problems that you were having before you contacted our office.
Well, I would say I've had a long history of hurting myself. You know, I got a slip disc when I was almost like 29 years old. So I've been suffering with a bad back my whole life. And then when I was around 45, I tore the cartilage in my knees. Because I was hobbling around so long, I ruined the other knee. So I've had both bad back and bad knees for years. And I saw it come up on Facebook. You were talking, and you were saying how, well, I don't know what you were saying, but it made sense about how everything connects and it goes through that back. And I do believe that the whole body is connected. And you seem to have that philosophy. So that's why I wanted to come here.
Did you try anything else before you came in here? Any type of therapies or been to any other doctors for your knees? Exercise, were you attempting anything?
I did get some shots in my knees, and I was taking the ibuprofens. Ibuprofens do work, but they're very hard for me to tolerate. I have a very sensitive stomach, and so I was looking for something natural.
Gotcha. We did a complete neurological examination. We determined that you were a good candidate for the procedure, and then you agreed to let us do the procedure on you. So can you tell me a little bit about the experience, like on your end? What did you experience during the procedure, and then afterwards, what results did you notice right away?
Well, I noticed that I could walk faster. That was a big thing, was that I could move so much faster. Right. And my husband even had commented on, wow, you're really moving around so much better, so you know when other people can see it.
So what are you doing differently with your life now? Like before you were having the issues walking, getting around, are there some other activities that you're doing now, or just generally enjoying walking more?
I would say that I like to dance. We have this Tuesday night, we have music where I live.
Okay.
And I would kind of just stand there like this, and people would say, "What are you doing?" And because I couldn't really move because
okay.
it would hurt. So that was one of the things I noticed, is that I could,
That's incredible. That's great.
yeah, I could move so much better. So
Well, I thank you for sharing, Susan. I really appreciate you coming on the program. I'm so happy that we were able to help you. The last thing I'm going to ask of you, if you could just look out to the audience and just, if they're experiencing similar problems, the inability to move around the way that they would like to, what would you tell them?
I would say this is natural. That was the thing that I really like about it. What he has here, and I really, well, so many things. Everything is healing. It's healing your body.
Not covering it up.
Not
Treating the
There you go.
symptom, but getting to the cause of the problem.
Right.
And that's why it's lasting. We're doing what the body already wants to do, which is to heal the area, and we're just helping it along. So I really appreciate you. Thank you so much for coming out and coming on the program. So if you or a loved one, if you're suffering with similar problems that Susan was experiencing, you've tried the injections, you've had the drugs, you've maybe even had procedures done, and you still have little to no improvement, I encourage you, take down our phone number, give our office a call. In only 2 visits, I will be able to determine whether you are a good candidate for our non-surgical operation. Again, I thank you for watching the program. God bless you. I look forward to meeting you, and I look forward to helping you. Hi, I'm Dr. Robert Davis with Active Health Knee and Shoulder, and I am here today to explain how our non-surgical operation has helped hundreds of people who were previously suffering with chronic degenerative knee pain. Many of the patients that come into our office have been suffering for a long time with knee pain. They've attempted the injections, they've taken the drugs, they've had various different therapies, all done with little to no improvement. This leads their doctor to tell them that they have bone-on-bone degeneration and that their only option is to have their knee replaced. Well, I'm happy to tell you today that we do have another option. Our non-surgical operation is a neurological treatment system that resets the communication between your brain and your knee, instantly decreasing pain and inflammation, increasing strength and flexibility, increasing blood flow, and assisting in tissue healing. You see, there are 2 different nerves that are associated with the movement of your knee. One is your sciatic nerve, which branches off the bottom of your spine and runs directly into the muscle that unlocks your knee. This muscle is attached to the upper bone in your leg and the lower bone. It's called the popliteus muscle. The other muscle is the other nerve is your femoral nerve, and your femoral nerve is what powers your quadricep muscles. So every time you take a step, when you reach forward with your leg or with your foot to take a step, that femoral nerve is firing so those muscles do their job. If there is interference or if there is static along the pathway, right knee is controlled by the left side of your brain, but if there is some type of lesion or interference along this pathway, what happens is you're going to lose tone. There's going to be a state of hypotonicity. Your knee needs to unlock before it bends. If it doesn't unlock properly because there is a lesion or static along this pathway, then the bones are going to shear together. When bones shear together, that doesn't feel good. They're going to cause chronic degenerative pain, and they're also going to put stress on the supporting structures that are supporting the knee and keeping the strength in the knee. So what we do is a non-surgical operation that resets the communication between your brain, the power from your brain running down the spinal cord and getting to that knee. And that restores the strength, it restores the flexibility, it decreases pain and inflammation, and it assists in tissue healing. So if you or a loved one are suffering with chronic degenerative knee pain and you've tried the injections, you've taken the drugs, you've had the therapies done, and you still have little to no improvement, I encourage you, give our office a call. We will do a complete neurological examination for only $60, and I will be able to determine within 2 visits whether you are a good candidate for our non-surgical operation. God bless you. I look forward to meeting you, and I look forward to helping you.
That's about it.
Okay. And is the pain in the same spot?
Yeah, now it's here.
Okay.
So this one mostly.
All right. All right, and back up. Whoa, that's definitely a lot lower. Any discomfort when you did that?
Just a tiny bit.
Okay. So, tell me, what changes have you noticed?
It's great. I don't feel anything walking up and down.
You were a 7 when you first started. What do you think it is now?
0.
Manny, thank you so much for coming out this
Oh, it's my
morning
pleasure.
and coming on to the program. I'm just going to ask you a few questions. The first question is, why did you come to my office? What type of problems were you
Oh
experiencing?
man, I was in a lot of pain. I couldn't walk up the stairs. I would have to hold on to the rail because my knee would give out at any time. You know, I couldn't play golf without medicating myself. You know, even walking. If I knew I was going to walk a lot, I had to bring pills with me just to keep taking them. I went to a doctor and he gave me shots. I went to another doctor, he gave me more shots and told me that I was going to be looking at knee replacement soon. So I tried another doctor and he told me I was going to need knee replacements. And I knew something was wrong. First of all, the quality of my life was horrible, you know, because I just couldn't move around. I was a very active man. I was taking ballroom dancing. I couldn't even do that anymore.
Yeah, I remember.
So I was on Facebook one day and I saw your ad and I said, let me try it. Let me see if this is real. And it was.
So we got you in the office, and I did the evaluation. I determined you were a good candidate for the non-surgical operation we do in the office, and you were skeptical. I remember you were very skeptical.
I was skeptical.
I was skeptical.
So could you tell me a little bit about your experience with the actual procedure that we did, and then afterwards?
I think I wasn't shocked by the procedure. You kind of explained that pretty well to me. I remember in the beginning, before the procedure, I was asked to squat down, and I could barely do that. And after the procedure, Becky asked me to squat down, and I almost fell over because I squat down so far. I was shocked myself.
Right.
It was incredible, you know. For me, it was immediate relief. Immediate. It wasn't 100%, but it was immediate relief. After the second one, forget it. I was playing golf again. I started dancing again.
Right. Tell me a little bit about that.
Now I'm doing salsa dancing. So,
Yes, that's
so
what I
that's
heard.
even better. And I'm loving that. I'm having so much fun with that now.
Right.
Now I go away on trips, and and I don't have to worry about medicating myself. I don't do any of that anymore. It's just the quality of my life changed so much. I tell everybody about you. Anybody who says anything about knees, I'm telling them to come here and see you.
Excellent.
Yeah.
What would you tell them if they're sensing that they just don't feel the knee replacement is the only option? What would you tell them?
I have been there. I've been there. I've experienced that pain, and I've experienced the fear of having to have 2 knee replacements. And this is the real deal. I trust him wholeheartedly. I recommend everybody I know to him. So if you're feeling pain, if your quality of life has been destroyed like mine was, I urge you to try it. Just come in, pay the $60, get it, and get an analysis. It's well worth it. The end result is that you're going to be happy again.
Thank you, Manny.
Oh, it's
Appreciate
my pleasure.
If you or a loved one are suffering with chronic degenerative knee pain, you've tried the injections, you've taken the drugs, you've had various different therapies, and all have been done with little to no improvement, I encourage you, take down our phone number, give our office a call. For only $60, I will do a complete neurological examination to determine whether you are a good candidate for our non-surgical operation. I appreciate you watching the program, and I look forward to meeting you, and I look forward to helping you. God bless you. Have a wonderful day. Good morning, Rain. Good to see you. Thank you so much for coming in today. Today what we're doing is I'm just gonna ask you a few questions about your experience in the office, but I like to start by asking you what brought you into our office? Why did you call and schedule that appointment?
I saw the commercial on TV, and I said, heck, if it works for them, it's going to work for me. And I suffered, a long time with my knees. I have arthritis in my knees, and it just bothered me. It hurt every day, and I said, I'm going in. I'm going to see this guy, and I hope he can do a trick with me or something, And so, I came, and it fixed me right up. It was fantastic.
Can I go back, and what type of problems were you having? Was it walking, navigating stairs, getting in and out of a chair? What were the main issues?
It was everything. Walking was a big problem, and going up the stairs and coming down was a big problem.
And so when you came, we did an evaluation.
Yes.
And I determined that you were a good candidate for the procedure. And then we moved forward and we did the procedure on you. We did a non-surgical operation on your knee. What did you notice after that procedure?
I was pain-free. I had no pain. It was fantastic,
And so after that procedure, what did we have you do right after the procedure that you weren't able to do before?
I wasn't able to really walk straight and up and down the stairs with no problem. And it was great. It was great.
And so what would you tell, if you had to tell somebody that was having similar problems, like if they were having chronic degenerative knee pain, having trouble walking, navigating stairs, could you tell our audience, could you just look at one of the cameras and just tell them what would your advice be?
It would be go and try it. There's nothing to lose. And I'm just happy that that I came in and got it done.
Thank you very much. Thank you for coming on the program. All right. If anybody is out there and you're suffering with chronic degenerative knee pain and you have tried the injections, you've taken the drugs, you've had therapy, maybe you even had a procedure done to the knee, and all of this has been done with little to no improvement, I encourage you, take down our phone number, give our office a call. For $60, we will do a complete neurological examination, and I will be able to determine whether you are a good candidate for the non-surgical operation that we perform in the office. God bless you. I look forward to meeting you, and I look forward to helping you.
Okay, slowly come back up. What kind of where are you feeling the discomfort there?
Well, just in both knees. Nothing that was like shooting pain or anything like that. Just
The tightness, huh?
tightness, yeah.
Okay. Hand railing is there, 1 foot per step. Good job. Holy smokes! I didn't say sit on the floor. That's great. And did you notice any different there?
Yeah, usually by then, I'm holding the ground. And I'm not gonna look at the stairs. I'm gonna look straight ahead.
There you go.
That has always been something that annoyed me, that I had to look down to see where I was putting my foot.
Good morning, Suzanne. Thank you for coming on the program this morning. What I'd like you to do today is I'm just going to ask you some questions about the problems you were having before you came in the office, what you've tried, to help the problems with your knees, the experience that you've had in the office, and then the results that you've noticed afterwards.
I've had long-term problems since I was in my teenage years. I had twisted my knee when I was out visiting my son, and I could barely get home on the plane. I happened to be reading something on Facebook and I thought, this has got to work better than anything. Previously, I'd had injections, I wore a brace, all kinds of things. But once I did that final twist on it, I just thought, this is ridiculous. I've got to do something so I can have a little better quality of life. So that was when I called you.
So when you came into the office, I did an evaluation. I determined that you were a good candidate for the procedure that we do. So can you give me a little bit of the experience when you came in, how long the procedure took?
Well, the main thing I can remember is you adjusting my knee, and it was amazingly excellent. I couldn't believe it.
So you had an excellent experience.
Yeah,
And the result was exactly what you were looking for?
Exactly. I've had so many people say, boy, you're walking so well, because some of my friends don't know me. The new people I've met in Florida don't know me other than limping. And now my friends that I've known for years and years, they're all, I can't believe you've been walked this well since the 80s.
Isn't that great?
So yes, it's been wonderful. I just feel really so much better.
Oh, that's excellent. I'm very happy for you, and it's very rewarding when we have people that come in that can't walk up and down the stairs or can't kneel, and then afterwards you're able to do these things without drugs, without surgery, without injections. The whole staff agrees. It just makes us happy. So what I like you to do, the last thing I would like you to do now is just, if you can tell our audience, just look out at one of those cameras there, and just what would you tell them if they were experiencing similar problems with their knees?
Well, if you've decided that your knee is not conforming the way you'd like it to be, right. And you don't really want to go under the knife, like I didn't want to do that, I think why not try it? If you can change the way you walk and the way your knees feel, and it just sort of transforms all over when the part of your body that was giving out on you is now maybe not like I was 25, but 50.
Right,
So,
right,
I'm not trying to do crazy things. I just want to do something that'll give me a longer time without a big scar on my knee. So
Fantastic.
That's what I think.
Thank you so much for coming out this morning. I really appreciate you, and it's always a pleasure having you in the office.
Okay.
So if you are a loved one, if you are suffering with similar problems that Suzanne was experiencing, then please give our office a call. If you've gone through the injections, you've taken the drugs, you've gone through different therapies, and all of them have been done with little to no improvement, then I encourage you, take down the number below, give our office a call. For only $60, we will do a complete neurological evaluation, and we will determine whether you are a good candidate for our non-surgical operation. God bless you. I look forward to meeting you, and I look forward to helping you.
Going from not being able to walk to meniscus growth, it's changed my life.
For me, it was immediate relief.
I was pain-free. I mean, I had no pain.
I think it took like 10 minutes, and I was better. I was walking better.
Everything is healing. It's healing your body.
If you can change the way you walk and the way your knees feel, why not try it?